Welcome back to another episode of Words of the Wise. Today I have Chief Cook from White Settlement PD in Texas. Really looking forward to this conversation. He has been an instrumental piece of developing some really cool programs in wellness. And so I'm really looking forward to having you on the show. Welcome, Chief Cook. Thank you.
Thank you for the invite. Yeah, this is such a contemporary, important topic. You can't go anywhere in the United States where leaders are not talking about these issues. So excited to kind of just share. And then the phenomenal work that's occurring around the profession. I've learned so much just going back through your channel and seeing what other chiefs and other sheriffs, what they're doing. And so, yeah, there's so many things that we can do as a profession just to make us stronger and then really take care of our employees.
Thank you. I really appreciate that. I'm happy that you're getting some value out of the podcast. And honestly, it's been awesome. Like I never ever thought that this podcast would take off in the way that it has and that I would have the opportunity to speak with individuals like yourself. So thank you again. I was hoping that maybe we could start with just a little bit of background on you. For anyone who's listening who doesn't know who you are, give us a little bit of context.
Sure. Yeah. So I got out of the Air Force. I went to the police academy mid 90s. Started at the Tarrant County Sheriff's Office, worked in the jail, your typical sheriff's office in Texas. Ended up working in dispatch. And so a lot of people don't know that about me. I started in communications. Then, when you go to the police academy, you want to be on the streets. And so ended up spending majority of my career in the Arlington, Texas Police Department. Arlington, it's a big city. It's on, nestled in between Dallas and Fort Worth. But it's kind of the sport mecca, entertainment destination for Texas. And so, Arlington being a larger agency, a lot of the topics that you've had guests discuss, they were, we had those impacts, and we kind of felt that. And majority of my career in Arlington was spent on the public relations side. Everybody does patrol, and I did the stint there, and everybody does, specialized units. I was in the traffic unit, but in 2011, I was made the public information officer of the department and kind of stayed there. I continued to promote, and ended up retiring in 2022 as a deputy police chief. I was born and raised in this little town called White Settlement. We're actually a military town, around 20,000 residents or so, home to Lockheed Martin, where they make the F-35 strike fighter, and then the Naval Air Station Joint Reserve Base Fort Worth. So we do a lot of military things out here, and there's a lot of crossover, especially in this space. Military is wrestling with the same types of challenges that we face in the law enforcement profession, and so from a unique perspective, a lot of times I find myself talking with my counterparts in the armed forces, sharing ideas as well on how can we, make our employees better? How can we make sure we're taking care of them? How can we ensure that when they get to retirement, they have a really long and prosperous retirement era that they can enjoy because, they've given their entire lives to public service. And so that's a little background on me. But just thrilled to have this conversation with you, and just again, just throw some nuggets of information out there that might percolate some interest in other leaders.
Absolutely. One of the things that kind of popped up in my head when you were talking, because you do come from a background of starting in communications and dispatch, and you said you were a public information officer, and then now you're saying, yeah, and I do also recognize that military is going through similar things. Do you think that the various roles that you've had throughout your career taught you that emotional intelligence and that empathy to understand what maybe other people within the organization and within your community are maybe going through? Because it's interesting, like when you're talking, I'm like, wow, like you learned that somewhere.
Yeah, we're not robots. We hire police officers, sheriff's deputies, dispatchers, professional staff team members. And yeah, we're going to provide them the training. Everybody has kind of that baseline. But in reality, we're all coming from different walks of life. We're all coming from different experiences. And some of us come from broken homes. Some of us have financial stressors. Sometimes we have, relationship issues and all of that. We can't expect our employees just to kind of, check that at the door, and then come in and be, these productive employees. And so, early on, especially in the public information officer realm, a lot of people think you're only dealing with like the community or you're only dealing with the media. but the vast majority of the challenges were internal communications, right? Making sure we're getting out the information that's needed and necessary for our employees to know that, hey, there's a lot of resources out there. Our human resource departments, they have a lot of tools in the toolbox, if you will. But in reality, if you're not aware of them, or if you're not in that situation where you ever need them, you kind of forget about that. And I think from a communications perspective, it really opened my eyes that we got to continually be elevating this conversation. We have to talk about this in briefings. We have to talk about this in our corporate communications, whether that's emails, brochures, annual retreats, whatever, you're doing as a leader to make sure that, hey, this is important. And here is what we have to offer to ensure you're going to be the best of the best and you're going to be taken care of. And it starts with communication.
And I really like that you mentioned that everyone comes from different walks of life. And I think that's really important to remember, especially in the context of how you're communicating certain things. And some of the best leaders I've ever met have known how to say one singular thing 100 different ways. And I think that when you're dealing with people, and you said we're in the people business, these are people, they're not robots, they're humans. Everyone's going to learn different. Everyone's going to need different resources. The way we communicate, how often we communicate is really important. And sometimes, saying one thing one time, one way is not going to be effective. So how can you, create those different channels where it resonates with everybody within the organization? And that's challenging, I would imagine.
Absolutely. I always remind our supervisors, and I'm talking about kind of the lower level of supervision. If you're waiting for the police chief or the sheriff to save the day,
Mm,
unfortunately, you're going to probably be disappointed. I mean, we just do not have the touch points. Doesn't matter what size your organization is, but that first line supervisor, I think it really starts there. And, we do leadership retreats where we bring all of our supervisors together. And I'm always kind of harping that, hey, yes, we're going to put out, corporate materials, like our employees, they're going to get a wellness guide, but it can't be something they get on day one in field training and then, they just shelve that and they don't think about it. I'm always challenging our supervisors. You need to be talking about these items because again, at any given time, an employee can be going through something. Something could happen, right? And we always want to be on the lookout, but not everything is visible. Not everything is overt, and we don't always really know what is exactly going on with some of our staff. And so, if we're continually talking about it in briefings, if we're talking about it in training, if we have the corporate materials that we're pushing out, if we're having the leadership retreats, and we're just kind of doing this holistic approach to our communications, that wellness matters. And we're not talking about just mental wellness. That's certainly important. Suicide prevention, yeah, we're going to talk about those things. We're going to say, it's okay not to be okay, but we really need to demonstrate that through our actions. And we only do that if we are genuine, if we're
mhm.
having candid conversations, if we're sharing examples that would be appropriate, where we're not talking about specific employees, but we're sharing kind of, general, things that have happened in the organization to say, hey, this was a success. If you are in financial difficulty, there are some tools for you. We can actually help you get through some of that. There are counseling services, even if it's not for you, but a family member of yours. There are things in place that we can do. And I think that's the approach. We have to all be dialed in, but that first line supervisor plays an integral role in my mind because they have the touch points with our employees.
I think you really hit the mark when you said like genuine, authentic conversations because sometimes, and maybe you have experience with this, the stories that I hear is it feels like kind of check the box and people are like, oh, well, like they say it, but they don't really mean it and it doesn't really have that substance. And so therefore, I don't really, grab onto it in the way that maybe I would if someone was, creating a culture that was authentic and organic and genuine. And it was something that, like you said, was demonstrated and backed by action. And I think that takes time to build that trust. But once you have that, then it's that ripple, like snowball effect that we talk about, where people are going to start to see other people having success with those things, and then they're going to then want to also have that same success in themselves. And so I really like that you threw that in there, that it's, yes, it's an ongoing thing. We're trying to build a culture, but it has to be genuine and authentic.
Absolutely. It's got to be people first.
Mm.
I always train even our command staff. Let's say, for example, there's a fleet crash, and the first words out of our mouth do not need to be what happened to the car or how did the crash occur. It should be, are you okay?
Yep.
Right. And if we really start to create a culture where the right questions are being asked at the right time, then people will see the authenticity that, you know what, command staff actually does care about me. I have an old saying that I utilize a lot. I don't know if the younger generation really believe this or not, but I always remind our folks that, hey, when you retire, because all of us will reach retirement, hopefully that's the end goal, right? And we want to have a great life after. There's so many things to do. And at my age, I start to see it comes into focus than it did like when I was in my 30s. But I always tell them, I say, no one's going to put on your tombstone how many hours you worked. Nobody's going to put on your tombstone that, you were the supervisor of the year or the officer of the year. And so you got to take care of yourself. And it doesn't mean that we don't want to be loyal employees to the organization. It doesn't mean that we don't want people to work hard in serving our communities. What it means is that, hey, you know what? This is not a sprint. It's really something that we take in stride and we make sure we've learned this, that all of these things that take tolls on us, shift work, stress, not, we always worry about the criminal element, and certainly that's not to be negated, but majority of our employees, they have health issues that come up, not so much on the criminal side where a criminal, person is assaulting them. Well, again, that happens, but those are the infrequent cases. Majority of the people that I deal with, I've seen this when I retired from Arlington as well. People, unfortunately, they may not have ate right. Maybe they didn't maintain the exercise. Maybe they weren't getting their checkups and all of that. And then it's a really sad deal because again, they've given their lives, their at least their adult lives in service and helping others. They should be able to enjoy that retirement. And so that's really important. And again, it goes back to what you said. It demonstrates that, look, we really mean what we say, that we do care about you. We want you to have fun at work. Certainly, we want you to be safe at work, but take it in stride, right?
I had another chief say something that stuck with me, and they said, no one's going to remember the overtime that you worked except for your family. And I was like, wow, because I've had moments, obviously, I'm in a different career, but I've had moments in my life where I have been all or nothing into my career. And I did sacrifice my family and things that I now regret today, like that I shouldn't have done that, where I thought that it was one or the other. I thought that the only way I would be successful is if I put everything that I had into this career, and there's no way that they could do it without me. And I now have perspective. I think you talked about this before, like when you get older, maybe you think a little bit differently than you did when you're in your 20s, and and every decade I think you become more wise. But now I understand that two things can be true at once. And I really live by this idea because you can be a really, really effective, valuable person within an organization or within your career, right? You can be at the top and you can be on your A game and give your best while you're there. But you can also do the same thing in your personal life. Both things can be true at one time. It doesn't have to be black or white or, one or the other. And I think that it's through that understanding that you start to reprioritize your time and the things that you're doing. And you do have that ability to kind of jump back and forth and be all in both. So maybe that's just through experience that you learn that, but hopefully if there's someone who's maybe younger in this career, that you can understand that you can be great at your job and you can also be great in your life outside of your job.
I love that. And I'm going to steal that analogy about the overtime. We do a new employee onboarding. So when we hire like police officers here, we'll send them to the academy in Arlington. It's the North Central Texas Council of Governments. when they get out of the academy, we put them in through before they even get into field training. They're with us for about 3 weeks doing administrative things. But one of those tasks, they have to meet with me for about 4 hours, right? We give them a new employee orientation guide, and one of the things I tell them is that I always try to share my failure points, and I always say, look, when I was brand new in the profession, I worked so many part-time jobs, right? Because what did I want? I wanted the extra money, right? And it's always that next thing you want to buy, right? You know, my parents always say they're spenders and they're savers, and son, you were a spender, right? And so I'm always working all these part-times, but that's equivalent to overtime, right? And it'll really make you ineffective in the long run because our bodies just are not conditioned to continually be in work mode all the time. And as you just pointed out, when we're always working extra, 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 whether it's a part-time job or overtime, we're likely neglecting our families or our personal lives. And so, again, it is so important. I try to instill that in them right when they're brand new in their career. Not that working a part-time is a bad thing. I think if you can, condition that sparingly and it, like you said, become good at both arenas, then hey, that's half the battle. But unfortunately, I've just seen so many police officers, even chiefs and leaders, they get burned out. I mean, we call it burnout. Like they get burnout, which means now they're cynical. They start developing health issues. I'm talking about physical health issues. Sometimes they develop emotional issues. And when you peel back the onion, you're like, wow, I wonder, at what point was the turning point, right? Because there was something there that caused them to just not be able to focus on what's important, and that is maintaining that work-life balance. I know there's a lot of leaders that don't believe in the term work-life balance, but I would challenge all of our leaders. We have to continue to try to advocate for that, try to create policies and procedures and protocols and put those things in place to allow our employees to, have hobbies outside of work, allow them to make the first, right? If you're a new family coming up, there's a lot of first, right? With your children and all that. We need to make sure that we're not so rigid in the way that we apply our protocols and attendance procedures that people miss out on that. Because again, when it's all said and done and we retire from this noble and honorable profession, we want to look back and say, you know what? I gave it my best. I've got a great legacy, hopefully, but I still have my health, right? I still have my sanity. And it's a good feeling, right, to walk away in that mindset versus you're retired, but you can't do anything because you got so many health issues, stuff going on.
Right. And I think everyone who's listening today, you know, every step that we make right now, every decision we make right now is an opportunity to make our future selves happy, and I shared with you um, before we, recorded this podcast that I was hearing so many I wish statements, from leadership. It was always, I wish, I wish, I wish, I wish. And it's like, how can we put that message out there of like, hey, like if you are proactive about your wellness, and even if you haven't been up until this very moment and you're listening to this right now, it's a new opportunity to take those proactive measures to make your future self happy so that you can have that longevity that we were talking about. I wanted to maybe rewind a little bit because I want to highlight some of the things that you have kind of been in the developmental stages of and helped to build from the ground up. And I know at your previous agency in Arlington, correct, you were a part of the early developments of the Blue Chip program. Can you tell anyone who's listening who doesn't know what that is? What is the Blue Chip program?
Yeah, so as it stands now, it's part of the Texas Law Enforcement Peer Network, meaning that now it's statewide. And there was some phenomenal work done by several employees at the Arlington Police Department before this was, as large as it is now. And essentially, the premise is easy. As leaders, we like to tell our employees, hey, it's okay to not be okay. But honestly, if you've been in the profession for a long time, I think there's a lot of employees that look at that as risky, right? What do you mean I can go to you and say I need help? Because they fear if I say that, you're going to take my gun from me, my badge from me. You may pull me offline, which affects my ability to earn money potentially. I won't be working part-time jobs, certainly, right? So I think there's all this fear. And certainly I think we're also doing a better job now in 2025 than we were, say, a decade ago. And that was the premise of the blue chip is to create a way where we tell employees it is okay to acknowledge that something's wrong, that you need assistance, right? But we wanted to do it a way that was anonymous. And that's why it's a success. That's why it is statewide. And so we created these little blue chips. As a matter of fact, they're still around today. You don't even need the chip now. I mean, now you can download the Law Enforcement Peer Network app and everything's in there. But when it first started in Arlington, we would have some providers around town, right? You would literally take your chip to the provider and say, "Hey, I'm here on behalf of the Arlington Police Department Blue Chip program." And what that meant was we would provide or we would pay for those services free, but we would never know who was using the service. We would only get the bill. And so that confidentiality was super important because that meant that, you know what, employees, again, they believe what we were telling them. They're like, okay, so if I really need help, I can do it in a safe space. I don't have to worry about my career. I don't have to worry about people being in my business. I don't have to worry about maybe that supervisor that I don't trust or that somebody in the command staff that I don't have a lot of buy-in with them. I don't have to worry about any of that because guess what? They don't know that I'm utilizing the service. And now again, it's expanded. I mean, it's so easy. Literally, if you're a Texas officer, you can download the app, you punch in your zip code, and there's all these providers that come up, and you can go and get free assistance. It's anonymous. It doesn't go back to your agency. And the goal is to get you back on the path of being well, because we know, I mean, we could spend the whole podcast talking about the traumas that are out there. I mean, unfortunately, in police work, you see a lot of bad things in society that can affect you. I had a case in my early career in Arlington where it was a medical call. Started as a child had walked away. They couldn't find the child. And as we get on scene, unfortunately, the child was found in the bottom of a swimming pool. And that was really tough for me at the time. My son was about the same age. My partner and I, we did our best to try to save this young child. And unfortunately, he passed away. And I remember thinking at the time, like, in the old days, you're just told, hey, go back to work. It's okay. You're going to be fine. Don't think about it. Well, we're not like that anymore. We know now. I mean, the science is there. Those things can affect officers and can affect dispatchers and can affect our professional staff. And so, again, I think we're doing a better job at recognizing that. But that's why the Blue Chip program exists today. That's why it's such a success. Matter of fact, not even just in Texas. I hear from chiefs in other states that have similar programs or are pursuing similar things because, again, cops like anonymity from the perspective of, you know what, I'm not going to risk my job. No matter what the agency's position is, I can go get my help and I can become better. And again, it's just the bill goes to the agency. So that's kind of it in a nutshell. But again, my former chief, Will Johnson, did some phenomenal work on that, along with several team members there in our mental health unit. And so my only role in that was, again, being the PIO, helping with some of the chips and getting the messaging out and making sure employees understood that, hey, we're for real. We're not going to know who utilizes the service. It's there for you.
Yeah. I I am a firm believer that conversations save lives, and the more you can offload the things that you go through in your life, the better you are and the more longevity you will have. And I've had the opposite. I know what it's like to shove everything down and posture up and keep going, and I would imagine you know exactly what that feels like too. And if we're gonna have the conversation saying that we're human, then I think there has to be that like level of understanding and grace that no human can go through 20, 30 years of cumulative trauma and not have any sort of outlet to offload those things. And they can't carry that with them their entire life without it impacting them. And so I know I've had a lot of conversations with chiefs across the country. And I know Texas is really unique with these programs. And it was actually something I was really surprised by because originally, when I first started 8 years ago in the wellness space, I was like, oh, like, I don't know, like Texas, like, I don't know. And then I started having these conversations. I'm like, wow, like Texas is actually really kind of leading the charge in a lot of these things. And I know that, peer support and EAP and having clinicians and all these things are starting to happen across the country. And I think that the more support and, like you said, confidential resources that you have out there, the more safe people are going to feel like they can actually utilize them. And then I really do think that it saves lives. I'll stand by
I
that all day long.
I concur with you 100%. One of the things I would offer to the listening audience too, a lot of the big departments, like in Arlington, we had a peer support team. I mean, because we have a lot of employees, right? And they were very careful on who was on that team. Certainly there's formal training on how you deal with this. Small departments, while you may not have a formalized peer support team, there are so many opportunities to still take advantage of programs like the Blue Chip, right?
Mhm.
Even if you're not in Texas. I'll give you an example. Fort Worth Police Department's next to me.
Yeah.
I made a partnership with them early on when I became chief here that, hey, can my team get access to your peer support resources? And of course, their chief was like, yes, absolutely. Neil Noakes was chief at the time. He has since retired. But Neil's like, anytime, day or night, if you need help, if your cops or your dispatchers or whatever encounter a critical incident where they need to, as you said, speak to someone, just to kind of verbalize, just to talk through, just to hear, hey, these are some of the things that you should be on the lookout for. We utilize them. We had a really bad car crash in our town that claimed the life of a young teenager. She was actually in her house and minding her own business, and an intoxicated driver lost control and drove through the house. And the first responders, not only just police, but I'm talking about fire department personnel, talking about our ambulance personnel. That was a tough case. And that was one of the first ones where, again, we just picked the phone up. Hey, Fort Worth, we're working this and we would like your assistance to help us check in with our employees. And so we've become very methodical to the extent, like, for example, like as a chief, I may show up when the conversation first starts, but I'm literally there to reaffirm that this is important and that you can talk about anything. But guess what I do after that? I leave because I want to create again a safe space for our employees to be able to have candid conversations with Fort Worth about, again, the potential trauma or the actual trauma that they're experiencing based on a call. And so I really applaud again your efforts in this space because again, 10, 15 years ago, it was kind of hit or miss depending on the agency. But now this is a really important topic because we have so many success stories when we can talk through things where employees can get the help they need. And guess what? Within time, they are backed not only to where they were operating, I would say they're even operating at a higher level based on the intervention and the assistance that they receive.
Yeah, I think it's a really important reminder because I think that a lot of times as humans, but also from, the conversations I've had with organizations, it feels very um, isolating. Like you almost feel like you're on your own island. And as a reminder to everyone that you do have other agencies, other people who have resources or who you can lean on. And I think that we are stronger all together, right? The more the better. And the more you can reach out and you can ask either for support or you can ask maybe other agencies if you're, someone who maybe doesn't have a wellness program yet or a peer support team yet. Maybe you can reach out to neighboring agencies and either utilize their resources or ask them how they did it. You're not alone in that either. And so I really appreciate you saying that there are other resources out there. Don't be afraid to ask. There are people who are willing to provide you with the education and the tools that you need to be successful. I wanted to kind of circle back to something that you had said earlier, and you actually touched on it a few times. And you had said that you never know what people are going through, that there are sometimes a lot of things going on beneath the surface. You talked about how this job can impact you on a physical level because of shift work, sleep, nutrition, like all the things that come, trauma, stress. You had shared with me offline a really personal story about your friend Kevin. Are you willing to tell us a little bit about him and what happened?
Yeah, Kevin Colby, dear friend, and many of your listeners in the North Texas area, or if you have, from the Bureau, will remember this story. So Kevin's career spent an enormous amount of time in the FBI. He was the assistant special agent in charge of the Dallas field office when we first met, back when we were hosting the Super Bowl. I believe it was 2009, 2010. And eventually, Kevin applies to the assistant police chief job in Arlington, and he gets selected and hired again by Will Johnson, and just does a great job. It's always nice bringing in fresh perspective sometimes, because he was able to challenge, Arlington, and hey, these are some of the things we did in the federal side that worked well. Maybe they'll work, maybe they won't, but at least we could really try. But the most important thing that Kevin did for us is he instilled fun back in the job, that it's okay to have fun at work. Like, you can still be safe at work, you could still follow policy, but to be fun. And really, he was talking from experience on how he had saw some of his peers, his friends who, the job just really took it out of them, and the longevity just wasn't there when they retired. Kevin was super fit. We used to work out at a place called Orange Theory Fitness, and he could outrun me on the treadmill, any given day. Just a really played football early in his life, a fit person. When you look at him, you would just say he's extremely high fitness level. So fast forward, he ends up retiring around the time that I did, 2022. He goes on a camping trip, and just, there's some discomfort in his body, and, gets back like anybody would, and goes to the doctor, and unfortunately was diagnosed with some very aggressive cancer. And I remember getting the phone call, and he kind of scared me because he called me and says, "Hey, are you available to meet?" And I'm like, "What's going on?" "Well, I don't want to tell you on the phone. Can you meet?" Him and his wife at the time, and Angela. And so my wife and I were good friends with them. They lived in Fort Worth, about 10 minutes from where I'm at now, and went in there, and I could tell that he was really in a bad space as far as this diagnosis, like anybody would, right? Because he had just retired. He did everything right. I mean, he saved his money. He was going to have, I mean, he certainly he would have his money was there to do all the things that you would want to do with an honorable retirement. And he shares this personal story, and again, because it was aggressive, and the type of cancer that he had, the prognosis just was not good, and unfortunately he did succumb to that several months after he had made the notification. I have received permission from him to share his story, and the reason I share it, especially with our young people, while no one could ever pinpoint what happened, what caused that can, we don't know. But what we can say is that as you're going throughout your career, the old term of life is short sometimes, meaning, are you making the most? Are you maximizing every opportunity? And I'll be honest with you, I never thought of that in my 20s, my 30s, maybe mid 40s, when I had to start, wearing reader glasses. I start thinking, maybe I'm a little bit more fragile than you think you are, right? Growing up. But the reason I share his story is it's a reminder that, hey, live life to its fullest potential, but take care of yourself. Because sometimes, even when you try to do everything right, even when you think, man, my fitness level's really high, we've seen this time and time again, where somebody suffers a massive stroke or somebody suffers a massive heart attack, and you're like, what in the world? They looked healthy, the quote unquote physically looked healthy. And
Yeah.
so it's just a reminder, we need to make sure that we're taking life in stride. But Kevin's legacy continues to live on. He did a lot of great things. But one of the things, most importantly, is people remember Kevin for the life of service that he lived, but how he lived it, which was always looking for opportunities to have fun, right? To always have a smile on his face, not get wrapped around the axle, try to de-stress. He always had a saying, hey, unless bullets are coming down range at us, we'll get through it. He
Mm.
always was able to bring that temperature down. And at the time, I didn't realize what he's doing, but he's bringing the stress level down on the executive team.
Yeah. Thank you for sharing one. And like what a story, like the last part that you shared about like his life, like that brought me joy and I don't even know him. I didn't have the opportunity to know him. I wish I did because he sounds like he was a great guy. And that story of like he tried to live his life with optimism and gratitude and fun is wellness. It really is wellness, and you talked about this earlier about like you start to get burned out and you start to become cynical and you start to focus on all the negative and what that does to your life long term. And to have someone who's like, you know what, we're gonna let it roll, we're gonna get through it. Like, let's laugh, let's smile, let's have a positive energy within, the agency. Let's live our lives in this way of gratitude and having a different perspective. And to me, that was the beautiful part of the story. So I appreciate you not only sharing what happened, but sharing about who he was, because I think that that is really important.
It is, and if you really kind of look at the profession as a whole, I mean, all of us have stories where when people don't look for optimism, they're not taking care of really that mental aspect of trying to keep things in perspective. They turn to sometimes alcohol. Sometimes I've seen turn to, prescription meds. I've seen illicit drugs. I mean, you just never know. And so you need to channel that energy in a positive manner. Again, the science is there. You mentioned it about this is wellness. And, we need as leaders to make sure that we not only are saying the right things, but that we can exhibit these types of behaviors and share relevant examples to help our employees know that, hey, there are better paths than going to the bar
Yeah.
or going to the doctor and getting on, prescription meds to, there's other things that probably we can do to, again, high level optimism, always being motivated, and then just keeping things in perspective, reducing our stress.
Yeah. One of the things too I wanted to kind of touch on because I hear this all the time from the younger guys and girls within this profession where, and you kind of mentioned this too, like I didn't really think about it when I was in my 20s or my 30s. And maybe it wasn't until my 40s that I was like, oh, like maybe I should start taking care of myself now. And I think that it's human nature to do that. I definitely was like that too. In my 20s, I never thought I'd be as old as I am today. Like, geez, like if I looked up at someone my age when I was in my 20s, like I'm an old lady. And so you don't really necessarily have that foresight when you're younger, but we hear from these young people all the time like, oh, well, like I feel good, like I don't need that. Oh, I don't need to be proactive. I don't need to go to the doctor. I don't need to do that some sort of screening. And I have someone who I respect a lot that's in law enforcement. He owns a nonprofit now because he has a story where it was very similar in the sense that he was a young, fit SWAT guy, mid 20s, like very young. And he experienced a cardiac event and he lived through it. But he had died for several minutes before and he lives to tell the story. And now his life is dedicated to education for, cardiovascular disease and cardiac arrest. And he works, in that community, but he also helps law enforcement to have AEDs and have education around AEDs. But I think it's this story and this message to the young generation, anyone who's listening to this, that you can be young and fit and take care of yourself. But that doesn't mean that you still shouldn't be proactive in, going to the doctor, having those early prevention type things. And I know that a lot of organizations are starting to offer those, health screenings and things of that nature. And so I have a two-part question for you. One, how did the loss of Kevin, really impact your perspective on wellness and how you lead in the message that you send to your people? But how do you also convince the younger generation to take care of themselves and showcase the importance of proactive wellness when maybe they feel like they don't need it yet?
Yeah, so two answers. The first, we do a it's almost weekly. Sometimes it's every 2 weeks. It's called Vincible training, meaning that we're
Mm,
vincible. We're not invincible, right?
mm,
And that's a Texas Police Chiefs Association program. And while a lot of the trainings do focus on like tactics, officer safety, there's a lot of stuff that talks about slow down,
mm,
right? We know that there are car crashes are a leading cause of death for police officers. Wearing seatbelts, right? Staying fit, going to the gym. What does going to the gym even mean? You know, what do you jump on an elliptical? Is a rower? I mean, all of that is important. And so on the first, so they're exposed to that, at least in our home agency now, they're exposed to that monthly at a minimum. The second thing that we implemented, and really this came out of what happened to Kevin, is these screenings. And I knew that if we just made it voluntary, it was going to be hit or miss. Because again, a lot of the younger generation, I mean, I get it. I was young once too. You're like, I don't need that. I
yeah.
don't want to go sit on a bike and wear a Darth Vader mask and measure my oxygen intake and all that. So we use a company called Frontline Mobile. There's a lot of different companies around the country. This one is based at the Fort Worth Fire Department. And one of the things that they do the health screening. And again, like Blue Chip, the results don't come to us. We don't sit there and we don't want to report. It is between Frontline Mobile and the employee.
Mm,
And they'll give them a rating, like, ultra fit all the way down to, hey, you may need to go see your primary care physician, right? And it's more than just, again, measuring oxygen or stamina or endurance. They'll even do a screening of some of your organs just to see if they can try to catch things. One of the tests that I underwent in my age bracket, I don't remember what it's called, but I remember going through this thing and they were scanning my basically my arteries and they were able to say, hey, you do have some calcium buildup, right? And so, what does that mean? I didn't know what it meant. They said, well, go talk to your primary care. And so again, from a personal standpoint, that let me know that, okay, these are things that, you can't reverse those things, but now I have the awareness, right?
mm,
Now I'm able to have a good conversation with my doctor on, oh, what's our plan, because I want to live, right? I want to enjoy retirement too down the road. And so that is one of the things that we try to do is we tell the employees, hey, the money's allocated. Take advantage of this. Because a lot of departments, they don't offer that. These are things that, maybe you get an annual physical, but you've probably been to those. Sometimes they're not as, invasive, or they're not as telling as, just checking out, like what's your weight, blood pressure, all that, blood work. These are much more to where it's designed for our profession, because again, we already know we're poor eaters, we're poor sleepers. When we do eat, it's certainly like a fast food and high saturated fat. And I mean, I go on and on and on, right? And so by doing these annual health screenings, we've tried to really get creative. The key, though, for the younger generation, I say all of that to say this. We have to find out, what do they like to do from a fitness perspective. Because if I tell them, hey, let's go to the track and let's roll around, run around, whatever. No, I mean, you'll appeal to the runners of the group, but I mean, a lot of people, especially if, let's say, they're not quote unquote in shape, that is going to be intimidating. And so we've tried to really think outside the box on how can we look to let them exercise on duty, right? Even in patrol. So we allow that. We have a policy now. They fill out a slip each year, and then they indicate. And it doesn't have to even be working out here. It could be any gym of their choice. It could also be, Peloton if they're doing it at home. The app tracks all that. And then we've become more innovative in the last couple of weeks, really talking about the pickleball. I didn't know what pickleball was. I'd heard it. And it's amazing. The younger generation likes that kind of stuff. And so if you look at my LinkedIn, I just put some stuff up yesterday. We had a big pickleball tournament this past week between police and fire. And we were able to get a lot of the young generation cops out there. And I'm gonna tell you right now, it was a workout because I saw them. They were huffing and puffing, and it's physical. And at the end of the day, though, they're getting that cardiovascular. So if I can sell like something as like pickleball, that hey, you know what? I'll let you work out on duty, go play pickleball. we can negotiate, good competitive rates as a city employee, then I think we've done our due diligence as leaders on trying to push them to just get active, just do something, because we know sedentary lifestyles increase the probability for health issues down the road.
Yeah. I'm really glad that you said that. I think a lot of people don't know that. A lot of people haven't like really dove into the stats, but one of the stats that I saw that like just blew my mind was that sedentary lifestyle, so sitting for long periods of time, and it was calculated like 6 to 8 hours, which is like what most people do, right? If you work an 8 hour, like 9 to 5, if you're sitting behind the desk or you're in your patrol car for, maybe you're working tens or whatever that is, it increased your chances of a cardiovascular event by 149%. It was something crazy like that where I was like, whoa. And it got me to stand up out of my desk because I will sit here and do, podcasts or work on my computer. And I was like, wow, I got to move. But I really like the idea of how can you make it fun and appealing? And it kind of goes back to what we said before. It's not a one size fits all. Like everyone's going to have different things that they like to do. And if you can, kind of determine what those things are, then you have a higher success rate than being like, oh, just do this one thing. It's like, how can we make this fun so that you're getting up, you're moving, you're counteracting the sitting, but you're also regulating your nervous system. You're also like improving your cardiovascular health. Like there's things that we are doing like beneath the surface. You're offloading stress. Everyone knows if you go work out and you do something fun, if you do pickleball for an hour, you come out and you're less stressed. So I really like that idea of like, how can you get creative, think outside the box, make it appealing, and try to counteract some of the things that are quite honestly inevitable in your career.
And one of the things I would challenge leaders to, if you've got a city, county, or wherever your workplace is, cities, it's an advantage for them to get their employees moving around too,
Mm.
because you have less health claims. And this, if when I have chiefs ask me, well, how did you get the city to fund these screenings? Because they're not cheap. Or how do you get a city to say, you know what? I want to pay for a gym membership, or right now we're working on, we want to pay for the pickleball. We want to include pickleball in gym memberships. One of the things I tell them is, give them the data to show that, hey, as because most of us are self-insured on the health side of things, pretty much, right? It's gone are the days where you go to the doctor and pay a $5 copay, right?
Right.
Everybody's insurance rates are going up. So if we can reduce our claims history, especially the cardiovascular events, the things that are really expensive from a self-insurance perspective, then your human resource director is going to be in there advocating with you as a police chief, saying, yeah, Mr. or Miss Mayor or Mr. or Miss City Manager, this we should pay for them. We should get our employees active. Matter of fact, we should buy them some kind of smartwatch that reminds them time to stand, time to move around, those kinds of things, and can show some trend data. So I do think we're just scratching the surface. I think that there's some departments I've seen, they're well in, advanced compared to what we're doing here, but we're just trying to move in that direction on what is it, a softball club, right? Is it soccer? Is it pickleball? Whatever it is, if we can challenge them that, hey, there's a variety of things that you can do, then we're all better served. Because we also know too, the science says healthy employees, they have better, optics as far as being, pleasant to be around, which equates to better service to the community.
Yeah. No, I 100% agree. I love the mentality. My final question for you, and then I'll kind of let you take the floor if I missed anything, but in the context of the younger generation and wellness, what words of wisdom would you share with someone who is earlier in their career? Maybe something that you wish you would have known earlier or something that's helped you along the way.
It probably didn't impact me initially, but one of the things that I like to, if you're asking for like words of wisdom,
Mm.
there's a lot of research on the mental health side on how these connected devices, right? Where, depending on the study you read, they certainly can impact our moods. They can impact our stress. They can, the certain types of light that even emits from them, like, If my wife is having trouble falling asleep, sometimes I'll joke saying, well, it's because you're on your phone. It's all, I've read something where that's not good. And I share all of that from the perspective. I tell our employees, you got to disconnect. I really think because we're just so connected, we're in this 24/7, 365 news cycle. There's so much negativity out there. There's so much, social media. Yes, there's advantages to be on social media to tell our story, but there's also disadvantages when you see all the misinformation or the disinformation. And so, I think from a really a mental health kind of perspective, it's good to disconnect. I don't know if the newer generation loves to read books, but I challenge them, say, hey, grab a book, immerse yourself in just continually learn, right? Continually look for opportunities to better yourself, but not so much through the devices and all that. And I've really had some, anecdotal evidence come back to me. Some of the employees like, you know what? I'm so glad when I went on my vacation, you said disconnect, deplug, like turn your city email off, just enjoy your family time away. This place is still going to be here when you get back. And so that would be certainly the word of wisdom. And we kind of hit on the two part of this, which was, early in my career, I worked way too many hours. I mean, I would chase the overtime dollars or chase the part-time dollars, and really it made me an old person really fast because you just cannot. And I was probably horrible family person because I was never around, right? I was missing not only the holidays and stuff and the important events, but I would just live at work, right? And in my mind, I'm doing the right thing. I'm bringing money into the family, and we're able to do all this stuff. But in reality, as I look back on it, I'll never get that time back. And by the way, I don't have that money anymore, so you know how that goes. You're going to spend it anyway. So slow down. Take the profession for what it is. Again, it's not a race. It's more of that kind of that long-term endurance marathon, getting from the starting of your career and all the milestones you're going to hit to, again, you want to really end up where you're walking away with a really good legacy, but you still have your health. You still got your mental acuity. You're financially in a good spot, and your physical health is there for you to enjoy many, many decades in retirement.
Thank you. Thank you
Thank you.
for your time. I really appreciate it. And like I said, if there's anything we missed, anything else you want to add, and I'll kind of give you the floor and let you be the one to give your signature here. But all I can say to you is thank you for your time, and I really appreciate you coming on here today.
No, the last thing I would just leave the audience with is we didn't hit a whole lot on it, but certainly the financial health, that's part of our wellness. I know that we always thinking of the physical or the mental or whatever the health screenings, but um, people that have financial issues, there's stress there. There's stress at work, there's stress in the marriage or in the family or the personal life. And so one of the things we do here, we partner with a company called Financial Cop. It actually is ran by a former Grand Prairie police officer, Nick Daughtery. And we pay for our employees to go through his course. And it basically teaches that, hey, manage your credit card debt wisely, right? This is how you buy a home. This is how you save money for college. This is how you save money for retirement. This is the risk with Social Security, all the things you would expect to find. And I do think that that's worked well. I've got a lot of good feedback from employees that have been through the course that say, that was interesting. I really had no idea how to manage my money, especially when you're talking about you're a 21-year-old kid, just graduated the police academy. Maybe you've never had to deal with that anymore, right? Because let's face it, they don't bounce really checkbooks anymore. Checks are kind of a relic of the past. And so
Mhm.
make sure we're, as leaders, we're taking care of them and teaching them good stewardship with their personal finances.
Thank you.
Thank you.
Yeah, I appreciate it, and hopefully we'll stay in touch. And I'm looking forward to hearing all the fun things that you continue to add to your resource list. And I want to kind of hear how those pickleball tournaments go in the future too. So
All right. Thank you so much.
thank
It's been a
you.
pleasure.
Of course.